Yeah, so today we are going to have a small interview with a person living with HIV. Because of confidentiality issues, we'll today call this lady, this special lady, by the name AC. That's not her real name. And so we want to find out how her daily experiences when it comes to, a person living with HIV. What are some of the things that she goes through? What are some of the treatments? What are some of the barriers that she has to encounter in accessing treatment? And what are some of the discrimination that she faces as a person living with HIV? So let's just go ahead and then interview her. Hi.
Hello.
I know this is not easy, but for the purpose of this interview, I want to call you AC.
Okay.
So, first of all, how did you get HIV? And when did you get it?
So, I got HIV through someone I was with somewhere 2014. Yeah. So we're together for some time. I didn't know that he had HIV actually. Then he passed it on. So I realized that I was beginning to get sick. I couldn't tell exactly what was wrong. And so I went to the health center and I was diagnosed with HIV.
So the first time you got the message, the information that this is your status, you have HIV, what went through your mind? I want to understand, like, how did you feel?
It wasn't easy. It wasn't easy at all because I felt like my life has actually come to an end. But you know that when you have HIV, like, you definitely end up dying. I was unhappy. I got depressed for a long period of time. So it wasn't easy for me at all.
And so I know you are staying with friends. Or how did they accept you, your family? How did they react to your news that you have HIV?
I couldn't tell them initially. I couldn't tell anybody about it initially. So
is it because you
I was scared.
You were scared.
Yeah.
Okay. But are you on the medication, the HIV medication? Do you go for treatment?
I go for treatment.
And what are your experiences when you go to access treatment? What are some of the challenges, or what are some of the things that prevents people living with HIV from accessing the treatment that we have?
I think the first thing will be stigma. When you have HIV, people have some kind of way they accept you and relate to you and all, and it's very unbearable. Like, it's not easy. Example, when you go to the hospital, you see they have a different place, a different center where you go for your medications, and then they have the different center where they attend to every sick person that comes in. Yeah. So as soon as people see you heading towards the other center, then it's in their mind, say, oh, wait there, or HIV. Do you get it? Yeah. And when you get there, the nurses, Charlie, remember some eyes and something, they'll be like, it's really not a nice feeling at all. Me, sometimes I get worried that maybe they'll how do I even put it? They'll bring out my identity. Like, one day I'll just wake up and it's all over. Say, this girl has HIV. I'm scared of the stigma that it comes with. Yeah.
Do you think, say, the attitude of some of these nurses sometimes prevents you from, going to the facility for your
Yes.
medication?
Sometimes I wish that someone can just go for my medication for me. Sometimes I wish I can get all my medication for like 1 year and I don't have to be going to the hospital frequently for them. But yeah.
What kind of advice would you give to the authorities on how best to help bring discrimination and stigma, especially at the health facility? Do you think that they should have some reporting system where people can actually report some of these discrimination or stigma that is being
well,
noted?
I think that's something they can do. Aside that too, they should look out for nurses who misbehave towards AIDS patients. I'm not saying that they should sack them, but we'll probably talk to them, because it's not easy. It's not at all.
And what is your message to someone who may be in the same situation as you are? What would be your encouragement for that person so that the person can also access treatment? Because we know that the treatment is the best solution. So what would be your encouragement?
The treatment needed. I've been on it from like 2014 till now, so it's been helpful. Maybe if I wasn't on the treatment, I'm sure by now I would have been dead or something. So I'll advise them to go for the treatments. Like, even though it's not easy to just walk to the hospital that you are coming for this treatment, it's my best advice to them to do well too.
So today we spoke with AC, a person living with HIV, who has been on treatment from 2014. She's been telling us that it's not easy for her, even how people relate to her has been affected because of her status. Access to treatment services is not that easy because there's a lot of stigma and discrimination even at the health facility. Attitudes of nurses, even at the community level, how people relate to her because of her status is very challenging. Stigma and discrimination still is an issue, and we all have to work and ensure that we reduce it to the barest minimum.